Good afternoon. Good afternoon, ma'am.
Good afternoon, ma'am.
ma'am. Good
Good
afternoon,
afternoon,
ma'am.
ma'am. Good afternoon, ma'am.
Good afternoon, ma'am.
Good afternoon, everyone.
Ma'am.
Yes,
Ma'am, we are not able to turn on our video.
Ma'am, same for me.
okay, wait, let me ask.
Okay.
Yeah. Sanma, hello, Sanma, you're there?
Yeah, I'm there.
Okay, okay. I'm audible, right?
Yeah, you are.
Dr. Bhargavi, ma'am, you're there? Sanma, she there?
Just hold on.
Good evening, everyone.
Good evening, sir.
Yeah.
Good evening.
Just check with ma'am. If doctor is there, we will then
Yeah,
start.
doctor is there.
Just
I'll
want to
just check
confirm.
once. Yeah.
Yeah, sure.
Yeah, she's there.
Okay, okay. So
Yeah.
shall we start then?
Sure then.
Yes, sir.
Okay,
Yes,
students, before we start, I would also appreciate if your parents can join too in the session. Like this is going to be interactive too with information on the specific subject that we are talking today. So welcome you all, dear parents, teachers, students, and all the other information seekers to the webinar, which is hosted today by Edunation in collaboration with the Health Basics. We have on the show our key speaker, that's Dr. Bhargavi, who is the consultant surgeon oncology from Sri Ramakrishna Multi-Speciality Hospital, Coimbatore. Ms. Sanma Shetty, who is the business head of Health Basics Karnataka. As you all know, today, the 4th of February is the World Cancer Day, which is internationally marked to raise awareness on cancer and encourage prevention, detection, and the treatment. Our primary goal of this Cancer Day significantly is to reduce the illness, death caused by the cancer. This year, World Cancer Day theme that is spread across 2022 to 24 is close the care gap. So World Cancer Day targets misinformation, raises awareness, and reduces stigma. Today on this occasion, we have, as I mentioned, Dr. Bhargavi. She's having an experience of 20 years plus. Her qualification include an MBBS, Master of Surgery, and a FRCS degree. So she's a surgical oncologist, and she had been treating surgical training and she graduated from Madras Medical College in the year 1999, followed by a super specialty in surgical oncology from the Cancer Institute, Adyar. She's instrumental in dispensing conscious, ethical, and appropriate cancer treatment to all the patients, irrespective of their status. She performs most of the cancer surgeries with special concentration and interest on breast cancers, gynec oncology, head and neck oncology. Before we move to the speaker, I request Sanma to give a brief introduction about Health Basics.
Sure. Thank you so much, Uday. Good evening, everyone. I'm Sanma Shetty from Health Basics. Health Basics is a digital pediatric healthcare platform that offers a collaborative approach to managing a child's health. We set up in-school health clinics and conduct health monitoring assessments for children, thereby providing end-to-end healthcare services in the school premises and beyond. I thank you all for participating in this webinar today, and given a chance and an opportunity and parent support, of course, we would love to collaborate and work closely with Edunation in times to come. Thank you so much, Edunation, for giving us an opportunity to get Dr. Bhargavi on board to talk about such an important and crucial subject, which is cancer. And what better day than today on World Cancer Day? Without much ado, I would like Dr. Bhargavi to take over the session. Over to you, Doctor. Thank you.
Thank you so much. This is Bhargavi from Ramakrishna Hospital. I really thank Health Basics because as a surgeon, you might think that I might be more interested in operating on more and more number of patients. But we are oncologists who are looking at things in the other way about. Okay, we really are looking out to prevention of cancer so that you produce less and less patients for us, because the disease is such that I would not say just give up. I would say that all of us can, whoever gets affected by cancer should always live with a mind that they will be cancer conquerors. I'm not wanting to be discouraging, but it's always, better to have no disease, better than have disease and treat it. So health is always well. And I'm sure my little friends who join me here, like Arnav Harshal, they will know that there is a proverb which says health is wealth, and there's another which says prevention is better than cure, isn't it? So I would want to really drive in the point that not to get a disease and then treat, try and prevent it, if not detect it early, so that we also will be able to help you to get cured. Thanks Health Basic again, and Sanma Shetty and Hari from this end, and Ms. Swati Rohit, who is in charge of Health Basics. I heard that they are doing a real good job wide and deep. My wishes for the project to go on very well. And I would start with my talk with a small word on.
No.
Hope my slides are seen well. I just want to say how this World Cancer Day started. I want my little friends not to forget this day because it's the day for awareness on cancer. It started in 2000 by UICC. Just see, if we have World Slapping Day and then we have Halloween's Day. So we have day for everything. So people thought, why not have a World Cancer Day so that we will remember the disease, which is only second in its incidence in the world. You know why crab stands for cancer? Because like how crab, buries into the sand all around. The cancer cells are cells which are unlike the, do I have a pointer on it? Do I have a pointer on it? Not possible. Unlike the normal cells which are conform to a regulated growth, that is, the teacher whips and the student studies. That is how the regulation is. Okay, but these cells don't conform to such regulation and they are just autonomous, they are just independent and they wouldn't budge to any form of control. So they are the ones which are called as the cancer cells.
Ma'am, your screen has gone, ma'am.
Just 1 minute, just 1 minute. They want to make some change on it. Just a
Sure,
minute.
sure,
I'm
sure,
so
sure.
sorry for it.
Yes,
Yeah,
it's
now we are
visible.
back.
Yes, it's visible.
Yes, ma'am, it's visible.
Are you able to see me? The slide?
Yes.
Yes, yes.
So the cancer cells are the ones which are autonomous, which grow as they like. Okay, because of small changes in the chromosome or genes. Okay, so the small drop in the ocean make it the ocean, isn't it? A small drop of water. The same way, if at all every one of us take awareness in our minds, we can make a gross change in cancer care in the world. So much so, these cancer cells, they undergo small minimal changes in the genes, but they produce a large change of a large tumor which can spread here there and disrupts the whole family, isn't it? So little changes can make a big difference. That's a picture just to show the blue colored cancer cells as against the pink colored normal cells. The pink colored normal cells go in a straight line as though they are being guided by a teacher. But while these cancerous cells, they go just haphazard, they break the basement membrane, they invade the tissue, and so they even spread to the rest of the body. How does it actually start? There's a small damage in the DNA which happens. It's not necessary that it should happen at birth. It can happen because of various other causes which we'll also see. And so they go out of control. Small DNA damage. The one thing I would want to point out is these can be caused by hydrocarbons. These can be caused by the tobacco-induced DNA damages or even the radiation-induced. What are the common myths? Before we really speak about cancer, I want all the spectators and the people who are attending to have in their minds the myths which we have to really do away with. Cancer is not a vitamin deficiency. It's not that you pop in vitamins and then you prevent cancer. But antioxidants, the vitamins A, C, and E, are supposed to keep the incidence of cancer less. All the same, some changes will respond to long-term vitamin treatment. But it doesn't mean that only if you had vitamin deficiency that you will have cancer. And cancer doesn't mean death. Okay? There is life after cancer for so many. You know, Yuvraj Singh, the cricketer, and you know Sharad Pawar, who's the NCP man. Okay, they all have outlived cancer, isn't it? So cancer doesn't mean death sentence. So we should never fear revealing presence of tumor. And is cancer contagious? Definitely no. We people have been treating cancer for so many years. None of us have contracted cancer because we touch or we speak to cancer patients or we move with them. So no family should keep them away. Does tumor biopsy spread to cancer cells? No, spread. It doesn't. It doesn't. It's only a false idea. And do e-cigarettes substitute harmless smoking? A word again, I will take it up later. It doesn't. It doesn't at all. They want my mask off. Hari says I should get the mask off before I speak. So maybe my face was better to look at with the mask on, isn't it? So cancer is not contagious. All these are the things which we have to do away from our minds, okay? And always we have the fact of denial in our mind. It's very common in our population that I wouldn't get cancer, just like how we think I wouldn't get corona. India thought corona is in China. It wouldn't come across Himalayas into China, into India. When it was in Maharashtra, we thought South wouldn't get affected. When it came to Kerala, Tamil Nadu thought it wouldn't get affected. Till we had our own cases happening. So we should never think that cancer would not affect anybody. Any tumor has to be taken note of to make sure that it's not cancer. And it's not that all the cancers are the same. Just because the next door neighbor had an advanced cancer and had a bad outcome doesn't mean we also are going to have it. Okay, so all cancers are not the same. And it's not that all cancers cause pain, and it's not that all painless tumors are cancer also. So anything that is deviation from normal should be taken care of early. And definitely we should never think it's incurable. There are so many patients who outlive cancer. A small point to make about the incidence. I know the slide will make you all feel bored. That is why the things are marked in red. See, it's only to show that the cancer incidence is grossly increasing of late. Than 20 years, 25 years back when we were students, things have changed grossly, and we do find that our OPDs are really crowded like the cardiac OPDs. It used to be only, myocardial infarction, which used to be high on cards, but now it's that we do have cancer incidence which is as high as cardiologist OP. You can see that the cancer incidence in Tamil Nadu has gone up from 58 per lakh population to 82 per lakh population in just 16 years time. So we all should be aware of cancer. And in males, the most common cancer is the lung and the oral cavity in our population, stomach, colorectal as well. In females, it's the breast and the cervix. So knowing so much so about the incidence of cancer in a population, what are the causes? High on cards is tobacco. I wouldn't say people who all don't use tobacco will not get cancer. That is, the corollary is not true. But if at all we used tobacco, we have high incidence of contracting cancer. That is point number one. Point number two is tobacco is one form of avoidable causative agent for cancer occurrence. So these are the two reasons why we should do away with tobacco. Government cannot do away with tobacco because it is a revenue earning. It's each person's mindset to make sure that you want to save your own revenue and not spend on healthcare. Please do away with tobacco. The second positive factor is excess weight and obesity, which is catching up very well beyond limits, especially after the advent of corona and work from home and study from home and everything from home. So excess weight and obesity. So the facts that I want to tell you are the diet, lack of exercise, and the pollution, the alcohol. These four agents put together another 10-15% of being the causative agent for cancer, where if we pledged today to change our own lifestyles, we can make a difference. Pollution, alcohol, exercise, diet. All these will convert into decreased obesity as well. And so 20 plus 15, 35% chance that we can reduce the causative agent exposure. Tobacco is used as, either the smoking ones or the non-smoking ones. We do find a lot of people still chewing tobacco, which is one cause for increased incidence of Indian oral cancer. And it has 1,000 carcinogens. You name anything like your toilet cleaner to the asbestos agent, everything is there in cigarettes. So if you still want to smoke, keep it in front of your eyes and think of it. It has a toilet cleaner It has the mosaic cleaning agent. It has the thing that is used in the asbestos industry. Do you still want to smoke? And after everything, you get a little bit addicted to nicotine, and then you have a really burnt body with lot of side effects. Not just cancer, it also makes you get predisposed to cardiac as well as neurological problems. So the causes of the cancer causes are mouth cancer, voice box cancer, leukemia, kidney, you name it, everywhere smoking will be a risk factor. So it causes 14 types of cancer. So do we still want to smoke? Think twice. If at all my lecture to talk to you today is really effective, if I found one of you leave your habit of tobacco, either smoking or chewing, I think my talk is done. The other smokeless tobaccos, these have been banned on record. That is why I say government cannot make rules. It's each one of us who have to take it up to say, I ban it for myself. I shrink myself from doing it. Only then the change can come. As a humble request to the population of India that is watching me speak today, I request you all to do away with tobacco. And e-cigarette, it's coming up in a great way. People think that e-cigarettes are great. It doesn't predispose to cancer. I think it's still a myth that we think e-cigarettes are great. E-cigarettes, you vaporize, you inhale the vapors. You don't inhale the smoke. That is all the difference. Still, you have the nicotine, which is the addictive agent. So you can never do away with it. So once you go to e-cigarettes, you still continue the habit. The best way to go to is go to chewing gums, the nicotine replacing chewing gums. Okay, so that will help you to have the nicotine for some time. After that, you can overcome the habit. Everything is in the mind of the person to ban the habit. And again, alcohol we think is all good for health, and we keep speaking about taking alcohol, 1 peg a day, my cardiac disease is away. I think it's all a way to escape from having good habits and do away with addictions. Okay, because alcohol is also one agent which has been implicated in multiple cancers to the body. Fat all over. Okay, we don't have part of the body without fat. It is not that it is genetic. I think if at all we thought something is genetic, we are fooling ourselves. Even the genetic obesity can be overcome by measures that we can really take by a good mind, which is wanting to persevere towards anti-obesity. Okay, because decreased physical activity has been found to be a predisposing factor for breast cancers as well as colorectal cancers and endometrial cancers. If the person were obese, it increases the risk for gallbladder cancer, kidney cancer, colorectal, endometrial, pancreatic. See, the problem is developing more and more disease and then finding more and more advances to treat it. It's good in a way. The pharmaco companies earn. We all find a lot of patients, but it's not good for the society eventually. Yes, I want all my young friends also to concentrate on all these things. These are very, very important because any disease process starts early. I think in the previous slide you would have seen, even if we stopped smoking tobacco or using tobacco, the changes that are already there still predispose the patient to cancer for 20 years after stopping the habit. That is, you quit tobacco today, for 20 years the risk remains the same. Only after 20 years of quitting the habit, the risk starts to decline, which means that so early, SOW, so early the good habits, so that we can reap the benefit through our lives. So, fast moving world, we want to westernize in the wrong way. Breast and colorectal cancer are rampant in the West. Now we find that breast cancer, we are competing with the West, not in using all these the refined flours, bread, and whatever what is this, burgers and pizzas and It's not that we are competing with the West only in the use of foods or in the way we make ourselves up. That, all of us look like models every day. All of us look like models every day. Nobody looks in their natural color. For everybody to know their natural color, it needs a lot of makeover to remove the makeup so that we will be our natural beings. Just think for a while, why nature made each one of us different? Variety is the spice of life. Why should we deny nature that? Isn't it? So I think we all should do away with using chemicals to the least possible. I'm not saying we shouldn't dress up beautifully. I know you all mightn't like a look of mine, but using too many chemicals also predisposes to cancer. All the lipsticks we use, all the cosmetics we use, all have loads and loads of lead, mica, which is all carcinogenic. They're all carcinogenic. So more and more westernization only is leading us on to a great competition with the West regarding cancer incidence. So quick moving world, we use a lot of processed food. Refined wheat flour is the norm in all the off-the-shelf foods. We take parotas, we take all kinds of breads which are all refined wheat flour. Refined wheat flour is the name, but it is refined with such chemicals which are used to even dye the hair. So think before you eat a parota, think before you eat a bread, think before you eat the noodles, because they have a lot of bleaching agents which are all bad for health. All the same, oils, virgin oils are the best. Hydrogenated oils and refined oils, anything that is refined, except our own behavior, anything else that is refined is bad, especially in consumption of food. We have to refine our mind not to take refined foods. That's the only refinement that we need. So that's a bad slide, but I like the picture and I thought I should give it to you. We find that we want a great yield at everything. We want lots of greens, lots of this, lots of that, which should be available every day. Watermelon through the year. How can it be possible? It happens because they use a lot of chemicals over it. So the rat that is in the field is asking the man who is there with his mask on, with the pesticide spray, do you also eat these with the mask on? Because it's so much bad for health. The colored drinks, anything that is beautiful to look at, take it with a pinch of salt. It may really be not good for your health. A blue colored drink, very inviting, appetizing. You go take a sip, think, is it going to be good for your health? What is there blue in the nature that is occurring? Nothing. So it is in color, it's a colored agent. Do you have to really consume it? Now Tamil Nadu government is coming down with a lot of crackdown on, the places, the vegetable markets where they are finding people are coloring the greens green so that it stays green for a long time, so that many people will buy. So whenever you find something that is looking extraordinarily beautiful, extraordinarily fresh, don't think they are fresh. They have been made to appear fresh. So take them with a pinch of salt, avoid them. Because by nature, greens cannot remain green and fresh for 5 days or 7 days. If it is so, then it has chemicals in it. Green peas cannot just run greens when you squeeze it or when you wash it. If so, it has something in it. Coloring agents have to be avoided. Another word of strong caution to people who think that Tropicana is a very natural juice. You find, I'm not wanting to brand Tropicana, many other Be Natural, whatever, you find a lot of natural beverages, orange pulp, everything comes with a pulp in it. You and I make a juice and leave it in the fridge. You and I take the tender coconut onto a package and leave it in the fridge. How long does it stay? Does it stay for 3 months or 6 months? Okay, they all have preservatives. And all of them have permitted colors, permitted preservatives. Somebody permitted it. Who permitted it? Think if you want to permit yourself to have it. So always be aware that whatever occurs naturally is what is good for health. Even if it means, less, it is okay. Quality doesn't come in appearance. Not all that looks good is really good for health. So chemicals in cancer, this I think I have already, made a point. Cancer shock in cosmetics, and we all of us would have gone through one of, fake news about a Jharkhand collector not applying makeup because it was a fake news. That's what I came to know, because her family did the mica mining. I think it is a point to take, not only based on humanitarian consideration. We should have humanitarian consideration on ourselves, not to use too much cosmetics. Cosmetics should be reserved for occasions, so that all of us look good at some point in time in life. But that doesn't mean that we look good all times in life with a lot of disease inside. Pollution is a great thing. All of us want to possess vehicles. All of us want to burn a lot of fuels. Smoke is also a bad agent. The other thing is, air pollution also comes from a lot of industries, and that is water pollution from industries. You find most of the water bodies are all polluted because then you will find water hyacinth growing in them, or they froth. When you find a lot of water being let out from the dam as a matter of, because it's going to overflow and they open the sluice wells, you find a lot of froth coming. Where does the froth come from? That is because of effluents from the industries which run. It's not that I want to make a very negative impact about what is happening. I want to make a strong point that each one of us should wake up to change our attitude towards ourselves and the society around. Any rule that is made by the government cannot be implemented, but for each one of our attitude to comply with it. Why should we comply with it? For our sake and for the society around. Radiation also causes cancer. A strong point to make.
Hello?
There are nowadays, that's what is there. The dictum is, there are no houses without a mobile for each person, each inmate, but there are houses without toilets. Okay, mobiles have made a strong way. Good that we have to be in the advancement era, keeping pace with it. It doesn't mean that we have to overuse it. Anything good, we have to take a point that there is a limit to the good that it can give. It's a double-edged weapon. Overuse is going to lead to the non-ionizing radiation which comes from the mobiles. We don't have strong data, but there are data which say that it might increase radiation to the head. You might say you will use earphones. Even that might produce a change. Who knows? People are yet to study. We have to study all this. It might take under 30, 50 years. By the time we really have, trials which say that mobiles and the earbuds and whatever the headphones, they all cause trouble, it might be too late. We already would have lived our life. So make use of the Wi-Fi, make use of the mobiles as less as possible, as far away from our body as possible, because we find not only cancer, but also a lot of things like PCODs are becoming very common. People say that it's because of using of the laptops and the iPads, which people keep on their laps and use, that causes more radiation. So we don't know really. Before we really come to it, it might be too late. So let us always use everything with a limit. Ionizing radiations have been known to produce, like the Chernobyl and the Hiroshima, Nagasaki, where it produces a DNA damage and people going for developing cancer. Non-ionizing radiation arises from the mobiles and Wi-Fi's. We have to use them because there is no life without it. Even now, I can't reach you if I didn't have all this facility. But let's use it as less as possible. So that is the data to say there are, mobile radiation ups the cancer risk. The other causative agents. So we saw about chemicals, our habits, then the chemicals, then we saw about the radiation, and now about viruses. Viruses can also cause cancer, and the most often known of the human papillomavirus and the cancer cervix, hepatitis virus and hepatocellular carcinoma, the Epstein-Barr virus infection and Kaposi sarcoma. These have been strongly associated cancers with cervix. Here, the preventable ones are the first two. For hepatitis B, we have vaccine. So it's coming up with the universal immunization protocol. And there are vaccines available for human papillomavirus also, so that the cancer cervix incidence can be brought down. Cancer cervix incidence is coming down in India because of healthy genital habits and availability of water and awareness. But still, we do have the vaccine that is available, either the Gardasil or the Cervarix. So that also will help us to do away with the virus causing germs, which has to be taken before the change can happen. The other thing is, the other thing is the hereditary cancer, which accounts for only 5%. The BRCA mutations are the common. Now, so much about the incidence. I would take under 7 minutes. Is that okay for the organizers?
Yes, doctor, we can go ahead.
Thank you. The levels of prevention, this is where I want you to concentrate on. The primordial prevention is before the occurrence of any change. Okay, that is, see, prevention of obesity by way of changing our eating habits, as well as like more exercise and kind of things. And the government's ban on the tobacco products, all these are the primordial prevention. And then the primary prevention is manage the risk factor. I'm obese, what do I do? Okay, how do I overcome? I'm already obese. Prevention of obesity is primordial. So that is where I want our friends to concentrate on. The primary prevention is, okay, I have the habit, I have the obesity, how do I overcome? Okay, and then is the secondary prevention, that is for people to go through screening so that we detect cancer early or before it really happens. And then tertiary is the treatment part. So that is legislation as well as exercises and kind of things to keep the risk factors down. And eat a lot of fruits and vegetables. And again, with a word of caution, all fruits and vegetables have to be really washed well and then used, because most of them, as I showed, that they have a lot of pesticides. So we have to take a low calorie diet with a lot of fruits and vegetables, as well as poultry products and whole grain cereals, brown rice, because raw rice is polished. As I told you already, anything that is refined is not good for health. And we have to drink enough water. Yes. And we have to have a proper body weight management. And what do we have to say no to? High fat content in the diet, which can be by way of a red meat or sugar rich desserts, and anything that has preservatives or food additives. Smoking has to be avoided. Alcohol, yes. And we all should have a active, healthy lifestyle. And we should ensure a dust-free environment, pollution-free environment. Pollution, as I showed already, we have to go by the norms for either our drainage water or for effluents from industries. And we also have to provide a tobacco or a smoke-free environment. And how all we can stop tobacco. I had one more picture that was a black and white picture where, you had black and white picture. Oh, it's so outdated, isn't it? But they lived a healthy lifestyle. Of late, lifespan is increasing, okay, because of advances in medicine. But what we are producing is prolongation of the quantity of life, that is the number of years. Quality is questionable because we find that they already are not able to walk because they have knee pains and hip pains and whatever. They are bedridden, but they live long. And for all this, we should have a pollution-free world. And how beautiful, isn't it? Yes, a word about the HPV vaccine. As I told already, we have the Cervarix and the Gardasil. The Gardasil 9 is now available in India. Gardasil used to be for 4 viruses. It should be taken. It's advised between 9 and 45 years of age. If it is in the pre-sexually active age, that is before 15, 16, we can take just 2 doses. After 15, 16, it has to be given as 3 doses. And preventive surgeries are also available. These are mainly for people who have, hereditary predisposition and kind of changes like this. I just put it there so that you'll all have the interest to see a surgical specimen, and no talk of a surgeon can be complete without a surgical specimen. So cancer is not a single disease. There are more than 100 types and any part can get affected. And more than 70% of all cancer deaths occur in the low and the middle income countries, that is in the developing countries. Our incidence is also vastly increasing. Why? Because population is more, our health infrastructure and accessibility still is not good enough, because 60% of Indian population still are in the rural India, as Mahatma Gandhi and Dr. Kalam said. And we are trying our best to reach out to the rurals so that we will be able to make healthcare complete. And 40% of cancer can be prevented by not using tobacco and having a healthy diet and physically active lifestyle. That's again to show the common cancers are the breast cancer and the cervical cancer. We should start doing a mammogram, anywhere between 40-50 years, and then do it annually. The radiation risk because of mammogram is not, it outweighs the benefit outweighs the risk of radiation. And regular pap smear is what is recommended for cervical cancer. For oral cancer, which is predominantly found, we have to have an oral examination, and any symptom that is beyond 2 weeks of duration, whether it be indigestion or ulcer or pain or swelling or anything that stays beyond 2 weeks, we have to take a good medical consent. That's a picture for a mammogram. It's only a low dose radiation, which is very less hazardous. That is a pap smear being done. It's a very simple procedure which can be done as an outpatient. I wouldn't want to go into ovarian cancer and see, all these are the cancers which are commonly present and we have to keep screening. But most common to be screened are cervix, breast, oral cancers, lung cancers. Prostate cancer is one of the commonest cancers in the males, especially in the older population. Some of them are coming with real bad advanced diseases now, which is unusual presentation. So we have to keep all these in our mind. We do have even colon cancer screening in Ramakrishna Hospital. That's a colonoscopy, snaring a polyp. Okay, that's an ulcer in the tongue with a we had to do a small surgery, remove part of the tongue and remove the nodes in the neck, and the patient did fine. So any oral ulcer is just not an ulcer. Any ulcer that does not heal by 2 weeks duration, let's wake up. That's a lung with cancer. So lung cancer is another one that is very common. Any cough that is persistent beyond 2 weeks, we have to seek medical help. So it's not that we should have any of these risk factors. Just staying in any of our metropolis is enough reason to say we can have lung cancer. So any cough that is persistent, make sure it's not lung cancer. So persistent headache, shortness of breath, any cough or hoarseness that refuses to go, any indigestion or difficulty in swallowing, any loss of appetite which is there for a long time, any sore, it can be in the foot, it can be in the oral cavity, anywhere, any bruise that doesn't heal, any change in bowel habit more than a week or two's duration, unexplained changes in the fingernails, any blood in the urine or stools, or when you spit, any mole that has changed shape or developed any ulceration, or any unexplained weight loss or tiredness, any new lumps, please seek medical help. So the treatment would be surgery, chemotherapy, and radiation. It's most often multimodality. Some of the surgeries might be extensive. Some of them, like we can do organ preservation surgeries. Depends upon how our patients present when they present. The other thing is chemotherapy. I do want to make a point about chemotherapy agents are umpteen in number. It has made surgeons work much easier regarding cure. Targeted therapy is a real upcoming field where we can take the cells and look for certain changes. And based on those changes, if at all those receptors are positive, for that antigen, antibodies are available, and it can just target the tumor cells and go and target the tumor cells in their growth pattern at various stages and cause real good benefit. So targeted therapy is the real say now. That's called personalized cancer therapy. Two patients with same sarcoma, two patients with same cancer, the same drug may not be useful. So that is what is personalized cancer therapy. So that person's cancer cells are subjected to a certain test called the next generation sequencing. And if at all they had those markers, the drugs can be used against them. Radiation therapy is the other one that is used. The myth is we keep thinking that radiation is like electric shock. Not so. It's just like, you go lie down under the machine and then you walk out. You sometimes doubt if treatment has been done. That is how it would be. So you beat cancer by how you live, why you live, and in the manner in which you live. I strongly want the spectators, the people who are listening to me, to keep this in mind, to make a gross change in the manner which we live, to make sure that we produce less and less of cancer patients, and we produce more and more of cancer conquerors. To produce less of cancer patients, we have to prevent, be aware. To produce more and more of cancer conquerors, we have to come up for treatment early. And sometimes we have to go through the screening procedures, right, so that we can detect cancer in the asymptomatic stage or the real early stage and make more people conquer cancer. No longer is cancer a word that will impend doom or death. Cancer is curable and cancer is preventable to an extent as well. So what cancer cannot do? It cannot cripple love. It cannot shatter hope. It cannot corrode faith. It cannot. I want every one of you to know this so that the stigma of cancer has to be removed from our minds before we end the talk. It cannot silence courage. It cannot invade the soul. It cannot steal eternal life. It cannot conquer the spirit. Before I really conclude, I would say that Ramakrishna Hospital opened its palliative care medicine hospital today, which is just to say we can't just cure cancer. We have to even care for cancer patients. Thank you all so much for the patient hearing. If I have overshot my speech time, kindly pardon me. I'm ready to take questions. I again thank the organizers. A strong word to say, stop smoking and let's save India. Thank you.
Thank you, Dr. Bhargavi. So now we can have questions which participants want to ask. You can use your chat box to post your questions, or we can unmute and ask. Doctor, before I'm not seeing any questions, so shall I ask you one question that how much is Ayurveda and homeopathy relevant in cancer treatment?
The thing is, it's not because I'm allopathy lady, I want you to advocate allopathy. Ayurveda maybe can do lots in prevention of cancer and in palliation, or in patients whom allopathy cannot do anything. See, a few things about alternate medicine. Certain things which cannot be cured by allopathy, Ayurveda and Siddha can be attempted. Siddha, I take it with a pinch of salt because a lot of them have metallic compounds and they do cause some kind of renal damage or sometimes unexplained hepatic failure when they come back for allopathy treatment. Ayurveda and homeopathy are acceptable. The problem is, if at all you are in a curable stage I take this stage again to reiterate repeatedly, if you are in an early stage, kindly give us the chance to treat you. Every day in the OPD, we see a patient or the other who go to alternate medicine, come back in an advanced stage because they don't accept the treatment when it is a little bit mutilating, because sometimes we have to remove the rectum and put back a colostomy, which they wouldn't want to take outrightly. So they go back to, alternate medicine and come back in an advanced stage. We are sometimes finding it very difficult to say. You have to go through the surgery, but you may still not be curable, in the curable group. So again, I request, if at all your cancer is early, kindly switch to allopathy for treatment. We might have anecdotal reports of cure with alternate medicine, but they are anecdotal. If at all you are in the stage beyond cure, we can go to alternate medicine. Sometimes with our hands tied, when we have to go to palliative chemo kind of things, we do open it out to the patient that they can go into alternate treatments. But if you are in the curable stage, kindly, for heaven's sake, stick to allopathy, because cancer doesn't grow in one day. It takes months to grow. Yes, Arnav, I will give you the chance. I will just complete and get back to you. The thing is,
So
cancer
doctor,
doesn't grow in a day.
yes,
It takes
so
a
doctor-
couple of weeks or months to grow. Alternate medicines bank on this. And when they come back with really advanced disease. I'm not against any form of treatment. Sitting as a treating physician in this side of the chair of the table, and we find it really, we are helpless sometimes that we have to tell even young patients that they have lost the chance to cure. So when you are in the curable stage, put up with the side effects of allopathy and kindly go through it. That's it.
Thank you,
Can
doctor.
I ask my doubt?
Yes, go ahead.
Okay. Sir, I want to ask that there are 4 stages of a cancer. So till which stage can the cancer can be curable?
Yes. There are certain cancers which are curable even in stage 4. Okay, like a testicular cancer with lung nodule, with one lung nodule, the patient can be cured still. Okay, but most of cancers are curable when they are in stage 1 or 2. Okay, the later in the stage of the disease, they are less and less curable. In most cancers, stage 4 is not curable. That is, if it has spread beyond that organ and its regional lymph nodes into other parts of the body like the lungs or liver, they generally are not curable.
Okay, so doctor means that it can be curable, and means there are different situations. Like if it's a lung cancer, it is curable on stage 4 or not, like that.
No, not that. It's not lung cancer. It's a testicular cancer with a lung nodule. Okay. Okay.
So it depends on which type of cancer it is.
Yes, exactly. But most types of cancers are not curable later in the stage. Stage 4 is generally incurable cancer.
But Tejas,
Yeah. Ma'am, I will read out one question. This is from Rudra Gautam. Because of COVID-19, most of them work on gadgets, parents as well, and kids. My question is, whatever gadgets we are using these days, how much radiation that affects the body?
Because of COVID, what was not possible?
No, all are using gadgets and they are working from home. So the question is, how much extent these gadgets radiation affects our body?
Charges?
Gadgets like mobile computers and all those things. Can you hear me, ma'am?
So could you repeat it, please?
The question is, how much gadgets can cause radiation and affects the body?
Gadgets?
Yes.
Gadgets.
Gadgets.
Okay. You mean now, okay, fine. Now I get it. the mobiles and Wi-Fi and kind of things, isn't it? See, there is no proven data about non-ionizing radiation causing cancer. Only thing is, as I said, it might be too late before we realize it, because the incidence of cancer is grossly increasing. One small, an observation, what I would like to put through is, you find that the crows have become much lesser, the regular sparrows have become much lesser. They say it's because of the erection of the mobile towers, okay, here and there and everywhere, isn't it? So much so, if it can affect the birds, why not it affect us, isn't it? So we really don't know the incidence of cancer because of non-ionizing radiation. There is no study, okay? Scientifically speaking, that is the truth. But only factor is, we see, even for Hiroshima and Nagasaki is a bomb explosion to cause cancer, and people to discuss and decide on it. It took time. Okay, so all the same, gadgets, the overuse is happening only recently in the past 10 years, isn't it? So it may take another 30, 40 years for us to really know what its effect is going to be. So only thing is, the incidence of cancer going up is because of something that is changing in the world. One may be just our diet, which is westernization. Other might be our health, lifestyle. We don't find enough time to cook and eat. We have to buy off-the-shelf foods. Off-the-shelf foods all come with preservatives. And anything that is virgin is not tasty, so we take only refined food. So, because we have a short time to eat, we want to eat tasty food. So we do not want any, anything that is, which is fibery and you have to chew for a long time. Anything that is easy to swallow. I can carry my burger in the hand, I can carry my sandwich in the hand, as I walk, I can eat. So, that time. All the same, the usage of gadgets, we still don't know. But only thing is, let us try and keep it as much to the minimum as possible and as far away from the body as possible, so that the radiation would really not affect us.
Good evening, ma'am. I'm Sonika this side, Principal Ryan International Academy, Hinjewadi. I would like to ask you, ma'am, as we know, the chemotherapy is also one of the treatment involved for treating cancer. And there is a fad related to chemotherapy that it leads to hair fall. Is it true, ma'am? And if it's true, then how far it's true? Because people generally are scared of this chemotherapy. They don't opt for it because they feel that it will lead to bald nets and all. So could you please tell me that, is it true?
Yeah. See, the thing is this, there is no treatment in the world without side effects. Okay. If there are no side effects, the treatment is not a good one. Okay. So take it from me. If somebody promises you treatment without side effects, it's not possible. All right. Chemotherapy does have its side effects. Okay. It's not that it cannot be managed. Okay. Advances in medicine have made sure that chemo-related deaths have all become, extremely less now. Okay, it's not that chemo induces death. Okay, so given that fact, chemo can induce morbidity. Okay, because the understanding is this: chemotherapy is a drug that acts on cells all through the body. Okay, so it acts on the tumor cell also. It acts on the normal cells also. So we can have, kind of things like a little bit loss of appetite, aversion to food, for the first couple of weeks after chemotherapy. We can have fallen blood counts. We can have, hair fall. All these are only temporary. They are not permanent side effects. Okay, so for us to say that we should not go through the treatment. Okay, all the same, radiation-induced cancer. I told you that it causes, direct DNA damage. But see, any of it has side effects. But then the benefit outweighs the risk. Okay, the risk of developing the complications of chemotherapy outweighs, underweighs, the benefits outweigh. So the patient gets cured of cancer, it's only a temporary side effect. Fear of treatment should be done away with, because it will look, when you stand outside and then look at something, it really is going to be, something which is worrisome. And all the same, when you take information from somebody else, okay, many a time See, there is something called individual variation, isn't it? So when the news comes from somebody else, we might think, their perception will be different and our perception might be different. Many a time when people come in, they say, do something without surgery. This is the first thing they would say. And once they are through surgery, they say, do something without chemotherapy, okay? But each person's body constitution is very different. Their reaction to chemo agents will also be different. It's not that one person had side effects, everybody is going to develop it. It is not so. One person has hair fall, some of them don't even have hair fall. Doesn't mean the drug hasn't acted for them. So each person's body constitution is different. Even so, cancer's behavior varies from person to person. We call it as individual tumor biology and the natural history of the disease. Okay, so though we categorize them as stage 1, stage 2, and under that we have subcategories, still each individual behaves differently. So there is no need for a generalization to say that chemo is harmful.
Thank you so much, ma'am.
Hope I have answered.
Yes, ma'am. One more question I have. Ma'am, I have heard and read also about the robot-mediated cancer surgeries. Like nowadays, they have these robots who can perform the surgeries, the cancer-related surgeries. How effective are these robot-mediated cancer surgeries?
Yeah, cancer surgery is very effective. It's not that because I'm a surgical oncologist. Surgery is one authentic form of cancer treatment. Maybe if you looked at Shruta's days, removal of the breast by holding the patient, was the first surgery that was described. So it's not that surgery will spread cancer. Surgery is a very authentic form of cancer treatment for cure, sometimes for palliation. That is, even when somebody asked, the Arnav asked, sometimes we do surgery for colonic cancer with single liver metastasis. We can remove both after giving good chemotherapy and combine it with the chemotherapy afterwards. So
I'm sorry to interrupt. I asked about robot-mediated surgery. Robots. Nowadays, robots
have... Yeah. See, robos, yes. The thing about robo is this. See, next came laparoscopy. After open surgeries, laparoscopy came in. Now robotics has come in. Robos can be used for benign as well as cancerous surgeries. Okay, it's only it can be used even for hernia repair, which is a small condition. It can be used for removal of the prostate for a cancer patient. It can be used for removal of a prostate for ordinary patient also. So that is how it is. So robotics are advanced surgical technique. It can be used for cancer surgeries also in certain parts of the body.
Thank you so much, ma'am.
But absence of robotic surgery doesn't mean cancer surgery cannot be done.
Okay. Thank you so much for this enriching session, ma'am.
Thank you.
There is one question from Chetna Nayak. What are the signs and symptoms of breast cancer? When should one go for mammography?
Blood cancer?
No, breast cancer. Breast cancer.
Breast cancer.
Yeah. What are the signs and symptoms of breast cancer, and when should one ideally go for mammography?
Yeah, right. See, generally, if there is no family history, if there is a family history, breast self-examination right from age of 20, breast self-examination from age 20 is recommended. Using the flat of the hand from the collarbone down to the nipple, and again from the costal margin, that is the rib margin to that, and all sectors of the breast have to be examined. This is for patients with family history of breast cancer. If there is no family history and there is no high risk, breast self-examination can be done at from 20 years. It is advocated, but mainly the mammogram is to be done at 40 years for 3 continuous years. Actually, we should do it annually according to the American Society of Cancer guidelines. It is yearly, that is annually from 40 years of age, continues on to 75 years of age. But what we normally advocate is to keep the, radiation exposure down, as well as the, the workload of mammogram unit down. 3 continuous years. If mammogram is normal, we can space it out to once in 3 years. In between, the monthly breast self-examination has to continue.
Good afternoon.
Thank you, ma'am. Thank you so much for the answer.
Ma'am, can you suggest some lifestyle changes which can prevent this breast cancer? Because
Yes,
it's
very
very common nowadays. So I want to ask that what are some lifestyle changes, adjustments we can make to avoid it?
Yeah, the main lifestyle change is diet and exercise. Okay. Because diet and exercise, off late, what we find is a lot of youngsters, around 15, 18 years, they are all coming with large breast lumps, which were all unseen of when I started to do surgery in 96. But, because some kind of dietary modification is happening in the society itself. It's not that rural is, it doesn't happen in the rural. There are rural patients also who come with large breast lumps, but many of them are benign, thank God. But only thing is, our diet has to be, most of them should be unrefined foods, which are bereft of preservatives, freshly cooked, better, lots of fruits and vegetables, properly washed, minimum of 3 portions of fruits and vegetables per day, not in the form of salads with cheese or whatever. We should avoid cheese and the kind of preserved food to the maximum extent possible, and definite yoga and exercise, exposure to sun. All these will help to keep the incidence of cancer down.
Thank you so much.
Yes, there is Ashta Chaudhary wanting to ask a question.
Yes, ma'am. I wanted to ask that can eating excess of any vegetable or fruit cause cancer?
The thing is, too much of anything is not good. Okay, that is a problem. Which says too much of anything is not good. Actually speaking, it is not so. Only thing is, see, there are a few nutrients which are available in plenty in specific foods, like, greens have a lot of potassium and kind of things. But in your age, I think eating too much of something is really not going to matter, as long as the food is a good one. What I mean to say is, see, there are foods like cauliflower and what is this, brinjal. They are all grapes. A lot of fertilizers go into their growth. Okay, if we are going to take too much of those only, then the chance that we get the pesticide content into our body is going to be a little bit more. So generally speaking, we should have a balance of all kinds of fruits and vegetables and not binge on any one of them. Everything should be in moderation, so that, we don't get the bad of anything, because there are vegetables which have higher concentration of use of pesticides and fertilizers compared to the rest. Does that answer my question, Ashta?
Yes, ma'am. And ma'am, I have one more doubt, that I have heard about these HeLa cells, and they were taken from a person named Henrietta Lacks. So in I guess 2020 or 2021, a person had got Nobel Prize for doing exact editing of DNA. So can we remove the cancer from her cells and regenerate that person again?
Generally, cancer is not caused just because we eat something a little bit too much. But generally speaking, we have to keep it to the minimum.
And is there any vaccine of cancer which prevents cancer?
Is there any vegetable that will prevent cancer?
Vaccine.
There's nothing in
Vaccine. Vaccine.
Vaccine, yes, vaccines are the HPV vaccine. I told you, the human papillomavirus vaccine. It is very much available. It has to be taken in the younger age. Any time after 9 to 16 is the ideal age. In which case it can be given as 2 doses. or if at all we are going to take it in the older age groups, up to 45 it is recommended after looking for the virus if it is present or not. If it is not present, the vaccine helps. If it is already present, it doesn't prevent the cervix cancer. The vaccine doesn't prevent occurrence of cancer cervix if the human papilloma virus is already present. So we have to have a test for the virus presence. If it is already present in the cervix, then the vaccine doesn't work. So ideal age is 9 to 16 before children become sexually active, and till 45 can be given in the absence of the virus.
Thank you, ma'am.
Thank you.
Ma'am, how much relevant is routine medical health checkups in the process of identifying cancer?
Can you go on the question again?
Routine health checkups.
Yeah.
How much is that important in detecting early cancer?
See, that is really a tricky question. But because the incidence of breast cancer is becoming very, very rampant. Every day in OPD, they find people who are 26 and 30s coming up with advanced breast cancers. See, the routine checkups will help us to pick up cancers which are inside. Like the kidney cancer is the commonest one that is picked up on master health checkups. The thing is, normal dictum is 40 is the age when we start developing even the rest of conditions like our hyperlipidemia, that is the fat content, the hypercholesterolemia, or cardiac conditions. Generally so, okay. There are people who develop heart attacks, what we call as a myocardial infarction, even at 20, 25 years, okay. But they are only a small percentage of the population. 40 years is the normal age for any master health checkup. But as I said, any symptom, any breast pain, any breast lump, any breast nipple discharge, any white discharge for vagina, anything that is staying beyond 2 weeks, we should seek medical help. Whether we go through a whole body check or not, we should seek medical help because the incidence of cancer is becoming very, very rampant, very, very rampant. So it's not a discouraging note. I just want to say that we should be aware of it so that we will be able to tackle it better. So 40 is a normal age for any master health checkup, including that for cancer. But then, we should not neglect any symptoms, even if we are much younger.
One last question we will ask, and after that we'll call it, end the session.
Sir, may I ask? Yes.
Yes, please.
Ma'am, I have one question. From detection of the cancer till the in that whole process, till patient is recovered from it. So how you just concentrate on the mental health of that person, because in that positivity is very, very important during that process. So physical pain we can cure with the medicine and all, but how you deal with the mental peace or mental health?
Yeah. See, the thing is, positivity is a way to live life. It's not just for cancer, isn't it? This is how I tell patients. Hope is the way to live life, isn't it? See, sitting in front of this laptop, that can be a small short circuit somewhere, I can get electrified, isn't it? But do I think about it? I don't, isn't it? So hope is the way to live life. Every moment or every act of ours in life has something negative if we really have to look into it. Most of the times we overlook the negativity, replace it with only positivity. The problem with cancer detection is it already has the stigma of not being curable. That is because of the lack of advances in treatment in the yesterday's. No longer is it so. Our population, many of them, if you ask them why they came in advanced stage, their reply would be they wanted to avoid medical consult lest something would be diagnosed in them. Okay. So, but that should not be in your mind. Okay. So the thing is, we should always think there is a better tomorrow, for which we have to go through some bit of hardships today, isn't it? Unless you walk the mile, you can't reach the destination. Unless children prepare for the exam, they can't have the good result of getting through. So that is how we look at it. Even if we come across recurrences, that is how we look at life. Okay, we keep saying you still have the threat to go on. Okay, they might reach the destination. So I think positivity is the same, and we should at no point in time let it go, isn't it? See, after all of us who are born have to die something. That is a different issue altogether. We should try our best to conquer cancer, which is a possibility. It's not that it's an impossible. It is possible whenever we detect it early. So the motto is be aware that cancer exists in the society, cancer exists around us. So let's be aware, it's not with a negative note. If we detect it early, we can conquer it with the help of cure. So I think positivity is the way to stay. We do have people who do the counseling part. And after all, nobody can replace the treating physician for counseling. We stand with them.
Can I ask my doubt?
Dear children, can you post your questions and email ID in the chat box? We will get back with your answer. Doctor is a bit late actually. So you can post along with your email ID. Doctor, thank you, Dr. Bhargavi. I'm just handing over the mic to Commander Narendra for vote of thanks. Commander, you're there.
Hey, how's it going, everyone? My name is Bhargavi. Yeah, good evening, everybody. I think, can you hear me?
Yes.
Yeah, so I think it was absolutely a very, very insightful and a talk which has brought us a lot of awareness about this topic. Not that this is not available in a website or online. You can always go and do that, which you should do. But hearing from the person who is an expert in this field and directly talking to you, I think that gives you a confidence of what is relevant to you as regards cancer prevention and cure. To some extent, she was more focusing on prevention because that is the key. Cure is something which we should not bank on. So I think taking cue from what she said, I'll just summarize that all of us, especially the younger generation who are yet to get into the space where they will get exposed to more and more pollution, more and more online activity, more and more mobile activity, more and more exposure to chemicals because of food which is being processed food. So I think for them, being aware is the most important thing, and hearing from the most knowledgeable person and person who is in the field is the only proof that we should follow what she's just now prescribed to us. So I think there are three things which are standing out for all of us and all children, especially. What we must say is that one is prevention by awareness, which is what we try to do. We were trying to bring to you the expert in the field who has spoken to you about the topic, which is to create awareness. And from here, you should take this topic to your house, to your parents, and speak to them, learn more and more about it, how to prevent, what to do. Then second thing is prevention by lifestyle changes and lifestyle, which is the most important part. From the time you get up in the morning to the time you go to bed, things that you do, all of them add in some or the other way to the risks of cancer. So let's find out those things which Dr. Bhargavi very articulately brought it out to us. What are those things in your exercise to healthy routines in the morning, to having healthy breakfast, kind of food that you should eat, kind of exercise you should do, kind of place and the preventive protective gears that you should use to prevent yourself from pollution. All these things are day-to-day activity which you have to adopt so that your risk to cancer is reduced. Will it be brought to zero? I think that is something which is not achievable in a normal world when you stay where you live. But can it be reduced? It should be, and it will be reduced. And that is what is our own responsibility. As she brought out many times, do not depend on government to bring in anti-tobacco, government to bring in anti-alcohol movement, government to bring in don't do this, such things. It is, we have to say, we will not do this, we will not do this, and we will not do these things. And we will do these good practices. So prevention by awareness, prevention by lifestyle changes, and one of the most important, especially for the grown-ups, is prevention through early diagnostic screenings. It is something which we all have to take home, that at a certain age, a periodic check is more important than going by, touch and feel. Main acha dikh raha hu, to I am good kind of concept. That doesn't work, especially for things which are happening deep inside your body. So having regular screening, especially for women, on many things which Dr. Bhargavi brought it out, even for men, it is equally important. With age, there are prescribed screenings which we should adopt and go with it. So as to early diagnosis, screening is half the cure done. That's a maxim we can follow. Early screening is half your investment in good health automatically done. So it is a small cost for a big change in our lives. So these three things, I think, Dr. Bhargavi, we are very thankful to you, and also to Sanma for bringing this forum together with us. And we at Edunation, Ryan Edunation, we want to bring in such topics to you which are relevant to your life day in, day out, so that all of us can stay healthy and do our role as active and healthy citizens of the society. So thank you, Dr. Bhargavi, for sharing this time with us and sparing this time for us through your busy schedule. And we shall remain in touch with you through Sanma's organization, or directly also, so that you can help our people be more aware of how to prevent occurrences of cancer in their lives as well as in their near India. So with this, Sanma and Uday, thank you very much for organizing this show, this workshop and discussion for everybody. I think Mugdha and Chetana, many of you want to ask many questions. I think it would be good if you share these questions to us or Sanma's organization. We will get the answers to you through Dr. Bhargavi, because she needs to leave for other important tasks of the day. Over to you, Uday and Sanma.
Sanma.
Sure. Thank you so much, Uday and Commander Narendra Kumar, sir. It was indeed a very insightful session. In case of any kind of queries which are still unanswered, you all can definitely write to us. We will get back to you on that. So on this note, I think we can end the session, Uday.
Yeah,
Dr. Bhargavi, thank you so much.
All of us can give a round of applause for Dr. Bhargavi for having done this wonderful job to all of us.
Thank you.
Thank you.
Thanks.
Bye, ma'am.
Bye. Thank you.
Bye, everyone. Bye. Ma'am. Bye, madam. Bye, ma'am. Bye. Bye, ma'am. Bye, ma'am. Bye. Bye, doctor.
Thank you all so much for your patient hearing. I have answered your question, child.
Yes, ma'am.
I have answered your question.
Yes, ma'am.
She have messaged you in the chat box. You can see that.
Bye. Thank you all so much.
Thank you, doctor. Thank you, Sanma.
Doctor.
Yeah. Bye. Thank you, everyone.
Thank you.